Are you wondering how you can become a pre-admission testing nurse? Well, you are in the right video. I've been in this nursing role for a year now, and I want to share with you guys all my tips and how you can also work in this specific specialty. And of course, it is beyond the bedside, so I know a lot of people are interested in looking for careers beyond the bedside, but will also want to stay within nursing. So this is a perfect fit for you if this is something that you're interested in. And let me just share with you guys what kind of skills and experience you need to help you land a job in PAT nursing. So before I start, I do want to mention that I have made a video about what I specifically do in my PAT nursing role. So I will link that video down in the description box for you guys so you guys can check it out after the video. But also I want to make sure that I mention in this video that this is an office type job. So you're sitting at a desk, you're talking with patients on the phone all day. In my specific role, I do not have direct patient care, but there are some departments, like some facilities, where there are pre-admission testing nurses who do provide direct patient care by like doing EKGs and drawing labs and all that, but we don't do that in my specific facility. So anyways, let's get right into this video. What type of skills do you need to become a pre-admission testing nurse? Now let me tell you, do you need experience in pre-admission testing nurse? No, I don't think you do, because I didn't have any at all, but I do believe that I had skills that helped me land this job. So some of those skills are care management, care coordination, chronic disease knowledge. So for example, knowing what kind of treatments are needed for patients who have specific chronic diseases like diabetes, etc. That's actually very beneficial when you're doing the telephone call where you're obtaining the whole medical and surgical history of the patient. Because if a patient tells you they're diabetic, but when you're reviewing the medication information with them, they don't mention any diabetic pills that they take or any insulin, then that's something that you need to question. Because I mean, most of the time, not always, but most of the time a patient who is diabetic will be on medication for it. And if they're not giving you that information, then you have to ask for it. So that's what I mean by having knowledge about chronic diseases. Also, other skills that are valuable to have are telephone skills, knowing how to communicate with patients over the phone. I also have a video on that where I talk about how you can improve communication with patients over the telephone. I'll link that video down in the description box as well. Triaging skills will also be super beneficial. Like I said, you are obtaining medical and surgical history and just a lot of information that is needed prior to patients going into surgery. So I think triaging skills is a great benefit to have, and it's something that you definitely should add onto your nursing resume. Also, other skills that I think are super valuable to have and to mention in your nursing resume are cardiology experience, such as EKG experience. Like if you've been a telemetry nurse, that would be super beneficial because you are reviewing cardiac workup and EKGs as well. Knowing your basic labs and what kind of labs are included in specific testing, so like a BMP, a CBC, a CMP, what's a PT9R, you know, all that basic stuff that we pretty much, I think we learned that in nursing school. So just knowing all that information will be a very great benefit to you when you're applying to these type of nursing jobs. Just try your best to highlight a lot of the nursing skills that you already have. Even if it was through nursing school, try to highlight those, and any like certifications you may have, also try to highlight those onto nursing resumes. Now, with that being said, you do not need any specific certification to work as a PAT nursing role because I didn't have any. I think what may be beneficial would be maybe having like a basic EKG course certification, but I don't think I didn't show proof of that because I think they just went based off of my telemetry experience that I had at the bedside. But I mean, they didn't test me or anything for EKGs. You kind of pretty much just learn, and just like based off of our protocol, you figure out like which EKG is abnormal and which EKG has to be passed. So it's not It's not a big deal. If you're not that great at EKGs, it's okay. I mean, you'll learn as you are working in the role. Now that I've mentioned all these skills, you're probably wondering, but Wendy, what if I'm a new grad nurse and I'm interested in working as a PAT nurse? Now, it's a little difficult just because I feel like a lot of the nurses who work in PAT already have previous nursing experience, but I don't want that to discourage you because you just never know. There are exceptions to everything, like I've said in multiple of my videos. Even if you do not think you're qualified or if you're a new grad nurse, I still advise that you apply anyway and try. I mean, nothing's gonna happen if you don't get called in for an interview. Just apply anyway. Now, my other tip is that if you have been trying and trying and trying to get into a PAT nursing role, but you haven't been successful, I highly advise that you try to look for a job that's not in PAT but is within a facility that has a PAT department, so that eventually you can transfer over to PAT when there is a nursing position open. You can either find a job at an outpatient surgery center, a hospital. So just finding a surgery center that has a PAT nursing department would be helpful for you in the future so that you can transfer over. Now, with that being said, I also want to mention that sometimes there are no PAT departments in facilities because they use their pre-op nurses as PAT nurses. So if you don't have a PAT department, maybe you can figure out from pre-op whether they use their nurses to do PAT job duties. So I think that would also be of great benefit. You may have to try to do a lot of research like within the hospital and find out like where these nurses are located so you can try and just break into PAT nursing. The other thing that you can do that I'm currently doing is working per diem or part-time in a PAT nursing role so that eventually when there is a job opening, then you can apply for it. And it would most likely be given to you if you are already in that department. So that's also another great way to start, just working per diem or part-time there to just get your foot into the door. I think that would also be of great benefit and would be a much easier transition as well. I do want to mention though, I've said it in the past, I have a friend who works in PAT and that's how I found out about this role. So it's important to network. I've said it before, I say it in a lot of my videos, network, 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 because you just never know who will know about a nursing job that you were never aware of. So I hope that you guys enjoyed this video and I hope this video was helpful. Make sure to like, subscribe, ring the bell for notification, and I will see you guys on my next video.